Hello everyone. So today we will be having a session on tympanic membrane. By the end of this session, you should be able to answer about the parts, the embryology and development, the nerve supply and the attachments of tympanic membrane. So let us start. Coming to the development of tympanic membrane. Tympanic membrane is developed from all the three layers, that is ectoderm, mesoderm and endoderm of the branchial arches. As the tympanic membrane is derived from three layers, the structure of tympanic membrane also consists of three layers. The outermost epithelial layer, that is derived from the ectoderm, and the middle layer is the fibrous layer. As the name suggests, it consists of three fibers, that is radial, circular and parabolic fibers. Then the innermost layer is the mucosal layer, which is derived from the endoderm, and it is continuous with the mucosal layer of middle ear. So coming to tympanic membrane, as we all know, it lies inside to external auditory canal and lateral to middle ear. So we learned the whole of tympanic membrane through these two pictures. The normal structure of tympanic membrane, the color is pearly grey and translucent. So when I say translucent, we'll be able to see few of the structures through tympanic membrane. The first structure is incus and incudostapedial joint. Here you will be able to see incus, this is incus and this is incudostapedial joint. And then shadow of round window. Here we will be able to see shadow of round window here. Then the eustachian tube area, that will be only rarely we'll be able to see the eustachian tube area. In this figure it is visible over here. Tympanic membrane is obliquely placed with an angle of 55 degree with the horizontal. The surface area, the total surface area is 99 millimeter square, but the effective vibratory surface area is only 55 millimeter square. This value is very important. Then it is concave from outside. So as the figure says, it is mainly divided into two parts. Pars flaccida, the upper part, and the other name is Sharpnell's membrane. Then the lowermost and the biggest part is pars tensa. So as the name suggests, pars tensa is little more tense and less mobile, and pars flaccida is more flexible and more mobile. So now first let us discuss about few parts of pars tensa. So as we can see, this we should understand is actually the malleolus. So this is the lower portion of malleolus, handle of malleolus. We have discussed all that we'll discuss all that in upcoming sessions. So this is an ear-ossicle malleus and this is called as the handle of malleolus. So where the tip of handle of malleus attaches to the tympanic membrane is called as umbo. So this is called as umbo. Okay. From umbo, there arises a cone of light in the anterior inferior quadrant. So this is called as cone of light arising in the anterior inferior quadrant from umbo. The side identification is usually by the handle of malleolus. Where the tip of handle of malleolus attaches, that will determine whether it is right-sided or left-sided. So here in this case it is right-sided. And wherever the handle of malleolus is facing will be the anterior side, and to the anterior inferior quadrant, in the anterior inferior quadrant will be the cone of light. I told you earlier, pars tensa is comparatively less mobile and more tense. So within the pars tensa, the periphery is comparatively more mobile when compared to the central portion of pars tensa. So the periphery of pars tensa is thickened to form a fibrocartilaginous ring called as annulus, fibrous annulus. So this is the fibrous annulus, and this portion that is attaching to the fibrous annulus and the ends of lateral process of malleus is the anterior and posterior malleolar folds. So these are the anterior and posterior malleolar folds around which lies the fibrous annulus. The depression into which the fibrous annulus fits in is called as tympanic sulcus. The depression into which the fibrous annulus fits in is called as tympanic sulcus. It is not clearly visible in this particular photo. Now coming to pars flaccida, the anterior structure which is only 1/3 of the total of tympanic membrane. It is otherwise called as Sharpnell's membrane. Coming to nerve supply, the lateral surface is supplied anteriorly by one nerve and posteriorly by one nerve. Anteriorly it is by auriculotemporal nerve, which is a division of mandibular branch of trigeminal nerve. Then posterior aspect of lateral surface is supplied by auricular branch of vagus, and the medial surface as a whole is supplied by Jacobson's nerve, that is a branch of 9th cranial nerve that enters tympanic plexus, that will be dealt clearly in the next video.